Hey everybody, Dr. Scott Uhal here, and welcome to the October edition of the Wealth of Health newsletter. This month, with the holidays coming up, the days are getting shorter, I want to share with you a concept called resiliency. And practicing being resilient is a great way to deal with the stresses that come along with holidays. Thanksgiving's coming up, Christmas is coming up, and that can influence our health and well-being also. So by being resilient and practicing resiliency, it's a great way to keep your mood and your spirits up and really enjoy the holiday season. One thing I would like to bring up about the holiday season, and it is that the days get shorter, there's less sunlight. And with less sunlight, that can influence our health and well-being very much so with our emotions and how we act and react to other people. There's a thing called seasonal affective disorder. It's a clinical diagnosis and it influences our mood. It can make us depressed, cause more anxiety, make us not want to interact with those that we care for. So developing behavioral protocols to offset that, such as practicing resiliency, is a great way to offset the lack of sunshine in the winter months. And with that, let's get into this concept of resiliency, starting out with a definition. And resiliency is an ability to withstand and recover quickly from a difficult situation that life might throw you. Or the Mayo Clinic defines resiliency as a way to successfully adapt to stressors while maintaining psychological well-being in the face of adversity in your life. So I guess stated differently, it's a way with dealing with difficult situations in a positive manner. So practicing resiliency can reduce feelings of anxiety, depression, anger, personal grief, and physical pain, believe it or not. But developing resiliency, it takes time and it takes practice to be good at it. And the more you practice it, the better you'll be at it. But here's the things that you can start to work on to build up resilient behavior. The first thing is to get connected. And what I mean by that is to surround yourself with good friends, people that support what you're doing and that you interact with well. And it's really, believe it or not, it's better to have a couple of good friends than many acquaintances as far as resiliency goes. And something else I'd like to add about that is to stay hopeful, be optimistic, look for the positive things in life. You have heard many times, is the glass half empty, is it half full? I would like to suggest for resilient activities and behaviors, the glass is half full. You can find the positive in things a lot easier than just dwelling on the negatives. And when you're constantly dwelling on negatives, that brings out thoughts and behaviors such as the depression, unhappiness, anxiety that I just mentioned. But when you look at things in a positive manner, you find happiness, enthusiasm, optimism. And these are the things that make us feel good and really help our mental health and well-being. Now, again, with this holidays coming on, the days getting shorter, you got to make time for yourself, and that's really hard to do. It's very common that we put our own needs and self-desires on the back burner so that we can do things for our children, our spouses, and those we love, especially during the holiday season. But do remember, you got to take care of yourself. If you don't, who's going to? One thing that seems like a no-brainer, but many times we avoid it because it's reminiscence of difficulties in the past. But if you know a difficult thing is coming up, plan for it, plan ahead. How can I overcome this situation so it doesn't present itself again when we're doing whatever it might be with whoever that person is? Two other things that are related to resiliency that I'd like to throw out there, and you can practice these on your own, and it could still go very well when you interact with others, and that's the idea of practicing gratitude and mindfulness. And what gratitude is, it's being thankful for the things that you have, the friends that you have, the opportunities that are presented to you. You don't dwell on things that you don't have or the door that's not open to you, because that kind of talk is called negative self-talk, and it really doesn't get you anywhere. And it spirals your mental thoughts down into a place that you really don't want to be. And another concept that goes along with gratitude and it's hand in hand is this idea of mindfulness. And with mindfulness, you're aware of your surroundings, you're aware of other people's feelings and their perspectives, and you take this into consideration when you interact with them. You've probably heard this, that sugar takes you a lot farther than salt, and this is a good example of that. You say positive things and constructive things when you interact with people, and you're going to get a lot more reward than when you show them their shortcomings or their weaknesses. So gratitude and mindfulness, they go hand in hand, and they are both very useful skills to interact and get the most out of not yourself, but those that you're around. One thing that I would like to mention that is probably a wee bit more important than some of the other things that we talked about is the relationship between your diet and your mental health and well-being. And at first glance, you might not think that there is a relationship, but there truly is. We are what we eat. And if you are eating a lot of processed foods, what I mean by that is man-made food. So it's things like, unfortunately, bacon and sausage and flour-based foods, cereal, those kinds of things, they actually compromise our health. And if you're eating those, you can go to bed and wake up the next morning with brain fog and mental fatigue. And why is that? Is that instead of your brain processing everything and organizing your thoughts at night, when you sleep, your body is actually digesting a bunch of really unhealthy food. And again, we don't realize it, but the lack of quality nutrition, and I'm talking vitamins and minerals, not just necessarily calories, really interrupts our mood with our sleep, and then that interferes with our day-to-day interactions with how we deal with people. So yes, you can wake up grumpy without realizing it, and it could very well be because of your diet. Well, that'll do it for this month's newsletter. I hope you enjoyed the introduction to resiliency and you start practicing a little bit. Like I said, the winter months are stressful, and with a little resilient behavior, it can go a long way. So we'll see you next month.